Okay, chapter 10 is we're going to talk about working with groups of patients. So the objectives for this lesson is to describe specific therapeutic benefits of groups, recognize new applications for groups, identify the major purpose of each type of group, recognize the qualities of a group leader, and identify intervention strategies for common management issues in groups. So the purpose of a group is to deal with current here and now issues. It allows the patient to gain awareness and knowledge about their maladaptive behaviors and thoughts. It also allows them to assist in decision making and problem solving. It provides educational and skill development. And family groups learn about mental illness and assist with coping with the family members. The benefits for patients is that they gain knowledge about relating and communicating. They gain acceptance, reassurance, and support. They gain hope and efficiency. It allows them the opportunity to test new behaviors. It's where they can share feelings and problems in a safe setting. They obtain reaffirmation of strengths and increased self-esteem. And they also feel increased self-worth and importance. Some therapeutic factors is that it instills hope. It's universal, so knowing you are not alone and others experience similar problems. It's imparting of information. Altruism, where patients experience being useful to others, and also corrective recapitulation of primary family group. It also develops socialization techniques. It also provides for imitative behavior, where they selectively model healthy behaviors of the leader and other members. Catharsis, where it's taught to express feelings appropriately. Existential factors, where a limit to the control of issues such as death or isolation. It provides cohesiveness and interpersonal feelings. Some types of groups is psychoeducational, where they teach the content and skills such as medications and problem solving. You also have maintenance, which provides support, responds to needs, and reinforces strengths and reality orientation. There's activity groups, which facilitates interaction, self-expression, and increased self-esteem, recreation, or exercise. And then you have self-help and special problems, where the members share a common problem. So John and Anne's daughter has a chronic mental illness, bipolar disorder. They have been feeling embarrassed by their daughter's behavior and did not feel comfortable discussing this with their family physician. Frankly, John says, we just don't understand her. We don't understand what's going on. So how can we even think about helping her? So NAMI, or National Alliance for the Mentally Ill, provides information for patients as well as families. They have classes that can assist John and Anne and learn more about bipolar disorder, as well as tips to assist their daughter. So where could the nurse direct John and Anne for further information about their daughter's disorder and what she is experiencing? Would it be psychoeducation group, maintenance group, self-help group, or activity group? The correct answer would be psychoeducational programs. Psychoeducational programs for families provide information about the illness, the medication benefits and side effects. It helps communication with the ill family member. It provides ways to manage crisis situations with patients. It provides ways to negotiate the mental health system and manage care. And it also provides community self-help groups such as NAMI. So John and Anne feel some relief now that they have been to a few psychoeducational sessions. Now, as they prepare for their first meeting with a self-help group for parents of youth with bipolar disorder, reflect on what goals John and Anne might have for their self and have for self-help groups. Next, we're going to talk about group management issues. So this is where the nurse needs to engage in spontaneous informal interactions with groups of patients in the day area during a card game. It could be formal groups that are planned and structured. The nurse uses group leadership skills to meet patients' interpersonal needs in a therapeutic milieu. And they also use effective communication throughout the shift. Self-help groups, they could focus on helping individuals with a specific problem. They're more homogeneity, which all group members share similar problems. It provides greater feeling of acceptance and understanding in the group with fewer feelings of isolation. There's more willingness to share and brainstorm with others about strategies. And the leader often specializes and is skilled in the problem area. Group leadership issues, you facilitate communication, it provides role modeling, it's confidential, it's in a physical setting, and it provides norms. So you come to the session on time and you remain for the entire session if possible. The nurse must be active and empathetic and able to provide structure. The groups are goal directed. They focus on the here and now. The leader states the group's purpose at the beginning of the session, and the final 5 to 10 minutes, they would summarize and close the session. And you would summarize positive feedback to the group. Some types of patients in groups that you may encounter would be the dominant patient, where they monopolize the entire session. They use the use of gatekeeping techniques to offer all patients the opportunity to contribute to the group is beneficial. The uninvolved patient, you need to support the patient by relating that each individual is important and capable of helping others, and you use respect and recognition. You may have a hostile patient, so you would use support to attempt to help them deal with their feelings of fear, self-anger, or unresolved anger towards others. The distracting patient, you want to use empathy, focus on the underlying need and the present reality, and refocus the group. So Andre has been very angry in his group. He feels that the nursing staff is not giving him his proper medication. He says no one on staff is listening to me talk about my problems. He attends a problem-solving meeting and angrily confronts the co-leader of the group. So, which of the following responses do you recommend to Andre? Would you say, Andre, I will help you discuss your problems with the staff after the group with the staff members involved? Or, Andre, please do not yell in the group. It makes the others uncomfortable. Andre, if you are having problems focusing on the group work, you may want to leave the group. Or, Andre, do you need a PRN to help you stay calm and not get upset? So the correct response would be A. He can learn to discuss his anger directly with the individuals involved in a therapeutic milieu. This should be done directly with the staff members involved with the problem rather than a group setting. The co-leader offering to coordinate such a meeting can ensure a therapeutic discussion.